Hey everyone, and welcome back to the channel. So, today we are tackling an important and life saving topic, the differences between left brain and right brain strokes, and what we can do to prevent them and also treat them. Strokes are a leading cause of death and disability, but the way they affect the body can vary greatly depending on which side of the brain is impacted. So, in this video, we will break down the key differences between left and right brain strokes, the symptoms to watch out for, and the steps you can take to lower your risk or support recovery. So, let's dive in. So, let's get to know what happens during a stroke. Before we dive into the differences, let's quickly recap what happens during a stroke. A stroke occurs when blood flow to a part of the brain is interrupted, either due to blocked artery or burst blood vessel. Without oxygen rich blood, brain cells begin to die, leading to the brain damage. This side of the brain where the stroke occurs is very crucial because it determines how the body and mind are affected. So let's first find out what is left brain stroke. What does the left side of the brain control? The left hemisphere of the brain is primarily responsible for language, speech, and logical thinking. It also controls the right side of the body. When someone suffers a left brain stroke, the following symptoms may occur. So there are four symptoms. First is speech and language problems. This includes difficulty speaking, understanding language, or slurred speech. Second is right-sided weakness or paralysis. Since the left side of the brain controls the right side of the body, a stroke in this hemisphere may cause weakness or paralysis on the right side. Third is memory problems, trouble with recalling names, words, or numbers. Fourth is slow or cautious behavior. Individuals may become more deliberate and cautious after a left brain stroke. So, what is the key takeaway? Left brain strokes often impact communication skills and cause weakness on the right side of the body. People may have difficulty expressing themselves but tend to be more aware of their limitations. So now let's find out what is right brain stroke. So what does the right side of the brain control? The right hemisphere is associated with spatial awareness, creativity and attention. It controls the left side of the body. So symptoms of a right brain stroke include there are five symptoms. First is left side weakness or paralysis. A stroke in the right hemisphere can lead to weakness or paralysis on left side of the body. Second is having vision problems, difficulty seeing or visual neglect, especially in the left visual field. Third is spatial and perceptual issues, difficulty judging distance, depth, or orientation, making tasks like walking or reaching for objects challenging. Fourth is lack of awareness or neglect. People with right brain strokes may not realize they have any deficits, a condition called anosognia. Fifth is impulsive behavior. Right brain stroke survivors may tend to be more impulsive or make decisions without considering their risk. So, what is the key takeaway? Right brain strokes often lead to more physical challenges on the left side of the body and impact spatial awareness, judgment, and attention. People may also be less aware of their symptoms. So, how do we prevent these strokes? While strokes can be life altering, there are some steps you can take to lower your risk. First is controlling blood pressure. High blood pressure is a leading cause of strokes. Regular monitoring and medication can help keep it in check. Second is managing cholesterol and diabetes. High cholesterol and unmanaged diabetes also increase the risk of stroke. So you need to keep them in control using diet, exercise and medication. Third is maintaining healthy weight. Obesity puts extra strain on the heart and circulatory system, raising the likelihood of stroke. Fourth is quitting smoking and limiting alcohol. Smoking damages blood vessels and excessive alcohol consumption raises blood pressure, both of which increases the risk. So you should keep them in moderation. Fifth is staying physically active. Regular exercise improves circulation, lower blood pressure, and helps maintain a healthy weight. So now let's talk about the treatment and recovery. First is immediate treatment. So here time is very critical. The faster someone gets medical treatment, the better the chances of recovery. Stroke patients often receive clot busting drugs or surgery to restore blood flow. Then, second step is rehabilitation. This includes five steps. First is physical therapy to regain movement and strengthen affected limbs. Second is speech therapy, especially important for those who suffer from aphasia or other communication difficulties after a left brain stroke. Third is occupational therapy to help stroke survivors relearn everyday activities and improve independence. Fourth is cognitive therapy for memory and judgment issues, especially in right brain stroke survivors. So that's it for today, guys. Stroke can help happen to anyone, but understanding the differences between left and right brain strokes and knowing how to recognize the symptoms can make all the difference. Remember, fast action saves lives. So if you found this video helpful and informative, be sure to like, subscribe, and hit that notification bell so you don't miss any future health tips. Also, take care of yourselves and your health, and I will see you in the next video. Thank you.